Hello everyone. Today we are going to study about the Norma occipitalis. So what is Norma occipitalis? Norma occipitalis is the view of the skull when we see the skull from posterior view. So suppose this is the skull which we are seeing from posterior, and this one is the superior side and this one is inferior side. So we can see here that the upper part of the Norma occipitalis is convex in shape, whereas from the sides this is flattened, and there are some bones which we can see here. So this bone is the posterior part of parietal bone on both sides, and this bone is squamous part of occipital, and this part of the bone is mastoid part of temporal bone. Now the suture which lies in between the parietal bone is known as sagittal suture. So this one is sagittal suture, and the suture which lies in between occipital bone and the parietal bone is known as lambdoid suture. And the suture which lies in between the squamous part of the occipital bone and the mastoid part of the temporal bone, that is this suture. This suture is known as occipito-mastoid suture. And the suture which lies in between the posterior part of parietal bone and the mastoid part of the temporal bone, that is this suture. This suture is named as parieto-mastoid suture. Now we can see here that the point where the sagittal suture and the lambdoid suture meet, this point is known as lambda, and anterior to the lambda approximately 2.5 to 4 centimeter we have one foramen on each parietal bone, and that foramen is known as parietal foramen. Now on the squamous part of the occipital bone there is a protuberance. This protuberance is known as external occipital protuberance. External occipital protuberance. Now from the external occipital protuberance there emerge two lines which passes laterally, and they reach to the rough part of the mastoid process. These lines are known as superior temporal lines. Superior nuchal line. So this line is superior nuchal line. And the line and another line originate from the external occipital protuberance, which are more arched than the superior nuchal line. They are more arched, and these lines are known as highest nuchal line. And from the external occipital protuberance to the posterior part of the foramen magnum, in between, in the midway of these 2 points we have another pair of line which is known as inferior nuchal line. Inferior nuchal line. Now on the mastoid part of the temporal bone we have a foramen which is near to the parieto occipitomastoid suture. This foramen is known as mastoid foramen. From this foramen, emissary vein passes. Now let's understand the attachment over the norma occipitalis. So this is the external occipital protuberance, and from the external occipital protuberance, a muscle gets its origin, which is named as trapezius. Now from the external occipital protuberance till the posterior margin of the foramen magnum, we have a crest here, which is known as external occipital crest. So this crest gives attachment to the ligamentum nuchae. So this one is the ligamentum nuchae. Now from the medial 1/3 of the superior nuchal line, trapezius gets its origin. So this is the medial 1/3 of the superior nuchal line. So trapezius got its origin from external occipital protuberance and medial 1/3 of the superior nuchal line. Now in the lateral part of the superior nuchal line, two muscle inserts. So these muscles which inserts just above the superior nuchal line is known as sternocleidomastoid muscle. Sternocleidomastoid muscle. And just below the superior nuchal line, splenius capitis gets its insertion. Now over the highest nuchal line, we have insertion of the epicranial aponeurosis. So this is the attachment of epicranial aponeurosis. And in the lateral part of the highest nuchal line, we have origin of occipital belly of occipitofrontalis muscle. So these are the attachments over the norma occipitalis. Thank you.